My name is Dr. Michael Lee. I'm a cardiologist and I specialize in rhythm problems of the heart. In this introductory video, I would like to explain to you how the heart works, including the chambers of the heart, the orientation of the heart, how the heart's arteries or blood supply works, and the electrical system of the heart model. This model is about 50% larger than the normal heart for educational purposes. The heart, as we know, has two upper chambers called atrium and two lower chambers called ventricles, two on the right, two on the left. In humans, the heart's rotated up and over to the left, so that the right atrium is pretty much in the middle of the chest cavity. The left atrium is behind that or posterior to that. The right ventricle or the right lower chamber is on the left side of our chest cavity, and if we feel our heart beating, it's generally the outside of the right ventricle that we feel beating against the inside of the left ribs. The left ventricle is behind the right ventricle. In terms of the normal blood supply, the blood that has already delivered oxygen to the tissues, that is the venous blood, comes back from the head and neck through a large vein, and from the legs and abdomen through another large vein. The blood then converges into the right atrium. There's a combination of passive and active pushing of blood from the right atrium across the valve down to the right ventricle. The right ventricle then contracts, the blood is pushed out to the lungs. After the blood picks up oxygen in the lungs, it then returns to the left atrium, goes through a valve down to the left ventricle. The left ventricle then contracts, the blood is then pushed out to the aorta and then out to the body. In addition to the heart muscle pumping out blood, the heart muscle itself needs to receive its own blood supply through arteries called the coronary arteries. There's one main coronary artery on the right side called the right coronary artery. On the left, there's a main one, and in fact this is also called the left main, which then subdivides into two large vessels. There's one coming down the front of the heart called the left anterior descending coronary artery. There's also an artery coming around the back in a circumferential fashion, and this is called the left circumflex artery. Each of these vessels, the right coronary artery, the left anterior descending, and the circumflex artery, have sub-branches that then subdivide to perfuse the heart muscle itself. In addition to the chambers of the heart, the valves of the heart, the muscle, and the arteries, the heart has an electrical system as well. There is initially a pacemaker site called the sinus node within the right atrium. And these are cells that will electrically fire about 1 time per second, 60 beats per minute if you leave them alone. There's also nerve input and there's blood input, so that if there's adrenaline flowing or if there's nerve input, then the sinus node cells will beat faster. For example, when you're either exercising or if you're nervous under different conditions like this. After the sinus node fires, the electrical rhythms then go through both atrium, both the right atrium and the left atrium, and these electrical rhythms then cause mechanical contraction of the heart. After the electrical rhythms activate both atrium, there is a second node or collection of cells between the atrium and the ventricles, and in fact this is called the atrioventricular node or the AV node. The purpose of the AV node is to receive the electrical signals from the atrium, to have an electrical delay, and then to fire and to carry the electrical rhythms down to the ventricles. When this happens, the specialized system, the specialized conduction system, have both ventricles contract simultaneously. The electrical rhythms would like to come back up into the atrium, but in fact there's only one normal conductor, the AV node, and the His bundle underneath that conducts down, and this needs a little rest period after being fired called a refractory period. This then prevents the electrical rhythms from coming back up. It then waits for the next beat to originate at the sinus node, to activate the AV node, and then to come down. This concludes the general introduction. We'll have a second video talk about your specific issues in the next video. Thank you.